Hi, Dr. Milky back with my fourth foot message of 2023. As I mentioned in previous videos, I'm starting with the toes and working back towards the ankles. I talked about general maintenance of nails, ingrown toenails, thick discolored nails, fungus toenails, and now I'm going to talk about sores between the toes, which can be very, very painful. And they can happen because toes rub together, maybe because shoes are a little bit too tight, maybe from certain activities. I've seen some bad, what we'll call soft corns. That's the term we use for the buildup of skin between the toes. I mean, corns and calluses are kind of the same thing. But when we see something like this between the toes, we call them soft corns. So they can be very painful, especially on the inside of the little toe when it rubs up next to the fourth toe, which is quite common just from genetics and the way tendons work. I've seen some bad open sores, we'll call them ulcers, on more often patients who have diabetes, but other patients as well. And oftentimes there's like a toe deformity or something there where the toes are crossing over, maybe hammer toes, which we'll talk about in another video. But something is putting pressure on the toes to cause sores like these. So soft corns, open sores between the toes. Sometimes you can get a wart between the toes, different things like that. So if you have some soreness around your toes and you're not sure why, sometimes looking in between, you might find something. And if you do, the best thing is to don't use any over-the-counter products. Maybe put a pad in there, maybe a little bit of Neosporin. If you're diabetic, rush into the office. But in most cases, you probably want to have it looked at, figure out exactly what it is, and see how we can fix it quickly. We'll see you next time for another video about toes again. We'll stay in the toes for a little while. See you next time.